Hi, my name's Tamar Packer, and I'm the Chief of Family Medicine at Hamilton Health Sciences in St. Joseph's. What you're doing for your community is sort of mirrored, and what you're doing for yourself, if you're pregnant, is dramatically reducing the likelihood that you end up very sick with COVID, potentially in an intensive care unit, and sadly, possibly facing death. And we have had local cases and deliveries of babies in our intensive care units in this city. So this is not something that sits far away. This is something near and dear to us. And by taking the vaccine, you're helping everybody, and particularly increasing the odds of well-being for the little one that's growing inside. I think that all the questions that were asked about vaccination for COVID have to be looked at from the perspective of not only is the vaccine safe, but is not having the vaccine safe. And if we balance out your odds as a pregnant individual choosing to not vaccinate versus getting the vaccine, it's absolutely clear that you're in a far better position by being vaccinated. We do have 2 years of evidence on millions and millions of individuals worldwide that speak to no concerns whatsoever with pregnancy. And sadly, we have a whole lot of evidence, both locally and internationally, for the devastating impact COVID can have on pregnant people. The vaccine is safe for all those who are trying to become pregnant. There was an observation that individuals who receive the vaccine sometimes skip a period or perhaps have their period delayed by a matter of weeks, and that seems to resolve within the next month's cycle. And that was the seed of the initial concern. It's been well studied, and as we all know, there's a major surge in COVID babies as we now know it, and we're seeing that surge continue in those who've been vaccinated. Trust has been an issue throughout. This has emerged really quickly, and I think it's new for most of us to really be given a whole lot of straightforward guidance from governments as opposed to healthcare providers, and I think that's probably fueled some of the mistrust or lack of belief. So I would reflect that people can look at NACI, which is the National Advisory Council on Immunization, in the context of pregnancy, ACOG, the American College of Obstetrics and Gynecology, and SOGC, the Society of Obstetrics and Gynecologists of Canada, both of whom have very clear guidelines on how best to care for yourself in the face of COVID when you're either attempting to conceive, pregnant, or breastfeeding. And the recommendations are clear across the board. With respect to kiddos, Canadian Pediatric Society has also taken recommendations that certainly endorse breastfeeding individuals take vaccine. The vaccine it's particularly important right now as we film because Hamilton is a city that has relatively low vaccination rate uptake, and we have pockets in our community where a good number of people sadly aren't vaccinated. And so if you have the ways and the means to get vaccinated, not only are you helping yourself, but you're helping them. And by helping them, you're helping everybody else around us. So the time is now.